A health screening service is coming to Southern Oregon that claims it can detect deadly events like a stroke or an aneurysm before there are any symptoms. Newswatch 12's Justin Bork joins us now live from the newsroom with more on why preventative screenings are on the rise and why some are raising concerns.
Well, the company Lifeline Screening is setting up their mobile clinic in Ashland next week. They use ultrasound and EKGs to tell your risk for things like stroke, aneurysm, or even osteoporosis. But the risks and benefits of that are up for debate. When a stroke or aneurysm occurs, often it's without warning.
Vascular disease can be silent until you have a major event. You could have a big stroke as your first event.
Organizations like Providence Vascular Ultrasound Lab and Lifeline Screening measure that risk before you have symptoms. Their suites of tests cost $100 to $150, circumventing insurers which typically don't cover diagnostics unless recommended by a doctor.
We do a large number of these, and by not dealing with insurance companies, we don't have that kind of overhead that they have.
But that hasn't always drawn the right kind of attention. A report from the U.S. Preventive Services Task Force claims vascular screenings can be misleading for people without symptoms, giving their ultrasound and EKG tests a D on a standard grading scale. And even screening experts say they can be dangerous if not interpreted properly.
The interpreter should be a radiologist or a vascular surgeon who has or someone who is trained in interpreting vascular testing.
But screening companies stress the emphasis on personal choice. They say advising someone to live a healthier lifestyle is easier said than done. And if concrete data can provide the motivation to stop smoking and eat healthier, it can lead to a longer and more independent life.
When you know about the problem, you tend to do something about it when you see it concretely.
Now, Lifeline will be setting up their clinic at the Ashland Grace Point Nazarene Church on April 2nd. Experts say regardless of the type of preventive screening, it's always best to consult with a doctor. Live in the newsroom, Justin Bork, Newswatch 12.